First, I'm going to wash my hands and put my gloves on. Hi, my name's Peyton. I'm going to be the student doing your exam today. Do you know what brings you in?
I had the toe exam.
Yes, we're going to do a full-headed toe exam. Are you ready to begin?
Yes.
Okay. First, I'm going to start by inspecting your sclera. It is white. I'm going to look at your corneas. They are symmetrical. I'm going to look at the iris and lenses, and they are blue in color. I'm going to look at the conjunctival sacs, and there's no swelling, discharge, or redness noted. I'm going to test your cranial nerve number 2, your optic. I'm going to see if they react to light. And they are equal and reactive bilaterally. They move from 3 milliliters to 2 milliliters, and they are consensual. I'm also going to test cranial nerve number 3, your ocular motor, number 4, your trochlear, and number 6, your abducens. I'm going to do this with the cardinal fields of vision, so I'm just going to have you stare at this and follow my pen here. Okay, and I don't know any nystagmus or lag, and I'm going to see if your eyes have convergence, so just follow this into your nose. And they do have convergence, and I'm going to see if they accommodate. So look here, and then look off in the distance, and look here, and look off in the distance. Correct. And they do accommodate as well. Next, we're going to look with the ophthalmoscope for the red light reflex. I'm just going to hold this 15 inches away from your face and come in at a 15-degree angle. And I do note the red light reflex. And next, I'm going to come in, and I'm going to look at your optic disc. And it is no hemorrhaging noted at the optic disc, and I do see the arteries and veins. Okay, next we can move on to your skull and face, and your skull and face are symmetrical. I'm going to move on to your hair. It is evenly distributed. It is brown and curly texture. I'm going to move on to your scalp. By looking through your hair, I don't know any infestations, I don't know any dandruff, scaling, or lesions. Now I'm going to palpate your scalp, your hair, and your head. And I don't notice any pain, tenderness, or masses while doing that. Next, we're going to move on to cranial nerve number 5, your trigeminal. I'm just going to close your eyes and tell me when you feel me touching. I'm going to start up your ophthalmic.
Forehead.
I'm going to move on to your maxillary.
Cheeks.
And your mandibular.
Jaw.
Cranial nerve number 5 is intact. I'm just going to have you clench your jaw for me. And there is a strong jaw clench and motor function. I'm going to move on to cranial nerve number 7, your facial. I'm going to have you smile real big, frown, puff your cheeks out, and raise your eyebrows. Cranial nerve number 7 is intact. I'm going to palpate your frontal sinuses and percuss. Look, you know if there's any pain.
No pain.
And palpate your maxillary sinuses and percuss. Let me know if there's any pain.
No pain.
Okay, now we can move on to your nose. I'm going to first check for patency. And I'm going to test your cranial nerve number 1, your olfactory, and I'm just going to close your eyes and smell this for me.
Salami.
Cranial nerve number 1 is intact. I'm going to inspect inside your nose, and I notice the septum is not deviated. I don't notice any nasal polyps, terminates, no swelling or discharge noted. Next, we can move on to your ears. Do you have any hearing issues?
No.
Okay. I'm going to perform the whisper test. This is going to check your hearing. I'm just going to whisper in this ear and let me know what I'm saying.
1, 2, 3.
In this ear.
Good morning.
All right, and that is cranial nerve number 8. Your acoustic is intact. Next, I'm going to push on your tragus. Let me know if there's any pain. This is testing for osteoexternia.
No.
And then push on your mastoid bone. This is testing for osteus media. Any pain?
No.
All right, and now we're going to take a look inside. I'm going to pull upwards and backwards on your auricle. I'm going to take a look inside, and I do note the tympanic membrane is gray and pearlyish. The cone of light is at 5 o'clock, and there's minimum cerumen. I'm gonna do the same thing on this side. Any pain when I push here?
No.
Any pain when I push here?
No.
And the tympanic membrane is gray and pearlyish. The cone of light is at 5 o'clock and minimum cerumen. Okay, now we can move on to your mouth. First, I'm going to inspect. Your lips are pink in color. I'm going to open up. You have moist mucous membranes, and your gums are also pink. I would test cranial nerve number 9, your glossopharyngeal, with the gag reflex. But we'll move on to cranial nerve number 10, which is your vagus. I'm going to have you stick your tongue out and say ah. The uvea is midline. It moves up and down with the palate. I'm going to test cranial nerve number 11, your hypoglossal. I'm going to have you stick your tongue out, move your tongue side to side. And you do have a strong motor function with your tongue. Inspecting your tongue stick your tongue out. It is pink in color. It is symmetrical. I'm also going to look and inspect your pharynx. It is pink in color. I'm going to look at your tonsils. There's no discharge, redness, or swelling noted. I'm also looking at your hard and soft palate. They are also pink in color. Okay, now we can move on to cranial nerve number 12, your spinal accessory. I'm going to have you shrug your shoulders for me. I'm going to have you turn your head against me and turn your head against me. Okay, cranial nerve number 12 is intact. I'm going to move on to palpating your trachea. I'm going to find your trachea. I'm going to move it one side, swallow, and I'll move it to the other side and swallow. And the trachea is not deviated. I'm going to move on to palpating your thyroid gland. I'm first going to start by finding your tracheal cartilage and your cricoid cartilage. I'm also going to find the tracheal rings. And once I find the thyroid gland, I'm just going to swallow for me. And I don't notice any swelling masses in the thyroid gland, or there's no pain or tenderness noted. Next, I'm going to move on to palpating your lymph nodes. So I'm going to start with the preauricle, the postauricle, the occipital, move down to the parotid, the tonsillary, submandibular, and submental. And move down to the posterior and anterior cervical and across the supraclavicular. And there's no swelling or pain while palpating the lymph nodes. Next, I'm going to listen for any bruits in your carotids. No bruits noted. Now we can move on to your anterior thorax. I'm first just going to inspect. It is symmetrical. I'm going to measure the A&P ratio, which is just going to come across your chest here. And the A&P ratio is 2-to-1. I'm going to listen, or I'm going to watch for respirations. I'm just going to count that for 30 seconds. And you have 16 respirations per minute. They are even and unlabored and regular. Next, we're just going to listen. So just take some deep breaths for me. You have clear and equal bilateral breath sounds. I'm going to have you turn around so I can do your posterior thorax. First, I'm just going to inspect. It is symmetrical. I'm going to palpate for tactile fermentus and have you say 99.
99, 99, 99, 99.
And I do feel those vibrations throughout. I'm going to palpate for equal expansion coming from C7 to T10 and just take some deep breaths for me. One deep breath. And my fingers do move equally apart with that deep breath. There is equal expansion throughout. Next, I'm going to percuss for Renaissance. And I do not know any constellation. Next, I'm going to percuss for CVA tenderness. I'm just going to come to the 10th rib, and I'm going to let me know if there's any pain.
No.
Next, I'm going to listen. Take some deep breaths for me. And we have clear and equal bilateral breath sounds. I don't know any crackles, rhonchi, wheezing. And I'm going to now test for Agnafi. I'm going to have you say E.
E. E.
And I'm just listening for the E to go to an A.
E. E. E.
And that is not noted. Now we can move on to your cardiac assessment. I'm just going to be lay on the ground for me in supine position. First, I'm just going to inspect. It is symmetrical. I don't know any masses or lesions. Next, I'm going to palpate for any lifts with my fingers. No lifts noted. I'm going to palpate for any thrills with the balls of my hands. No thrills noted. Next, I'm going to listen to your heart sounds. I'm going to start at the aortic, move to the pulmonic, to Erb's point, tricuspid, and mitral. I'm going to listen at the apex for a full 60 seconds. I note that the heart rate is 62 beats per minute. It is normal sinus rhythm. I'm going to listen for S1 at the apex as well, where it is the loudest. And I'm going to listen for S2 at the base, where it is the loudest. I'm going to listen for any murmurs or abnormal heart sounds at Erb's point, tricuspid, and mitral valves. And no abnormal heart sounds or murmurs noted. I'm going to inspect for PMI with tangible lighting. I'm just coming from the mid-clavicular line to about the 5th rib cage. Next, I'm going to palpate the PMI. And it is about 2 centimeters, and it's a soft throb. Now we can move on to the abdominal assessment. First, I'm just going to inspect with tangible lighting. I'm looking for any hernias, lifts, pulsations, swelling, edema, none noted. I'm going to listen at the descending aorta, artery, the renal, the iliac, and the femoral. No brutes noted. I'm going to listen for normal or for bowel sounds in all 4 quadrants. Normal bowel sounds noted in all 4 quadrants. Next, I'm going to percuss for any dullness or air spaces. None noted. I'm going to percuss for the liver span. I'm going to come over to the mid-clavicular line and I'm going to come down until I hear a change. Noted. Into dullness. Noted. I'm going to mark those and measure. It is about 3 inches. And I'm going to confirm that with the scratch test. I'm just looking for a change in sound. Noted. Change noted. Change noted. Scratch test confirms the liver span. I'm going to have you roll over a little bit on your right side. Right there. And I'm going to percuss for the spleen. I'm going to come down the mid-axillary line. Spleen noted. And let me roll back. Now we're going to perform light palpitation. Let me know if there's any pain.
No.
Deep palpitation. Let me know if there's any pain.
No.
I'm going to check for Murphy's sign. which is cholecystitis. Take a deep breath out for me and let me know if there's any pain. I'm just coming under the 12th rib cage.
No.
I'm going to check for McBurney's sign, which is appendicitis, and let me know if there's any pain. I'm coming over to the right lower quadrant.
No.
And I'm going to check for rebound tenderness, which is Bloomberg's sign. Let me know if there's any pain.
No.
And this I would just be looking when I release if there is more pain or not. I'm going to palpate your inferior and superior inguinal lymph nodes. Let me know if there's any tenderness or pain.
No.
And now I'm going to check for Brzezinski's sign. I'm going to have you flex your head forward, and I'm going to look for flexion at the hips and the knees. None noted, so that sign is negative. Next, I'm going to check for Kernig's sign. I'm going to lift your leg up and inward and see if there's any pain. And this test for meningeal irritation. None noted. All right, now we can have you stand up. We're going to test your, we're going to listen to your pulses. So I'm just going to palpate your pulses. I'm going to start with your carotids. 2+ pulses noted, equal and bilaterally. Move on to your brachial. 2+ pulses noted, equal and bilaterally. To your radial, 2+ pulses noted, equal and bilaterally. To your posterior tibialis, 2+ pulses noted, equal bilaterally. And to your dorsal pedius, 2+ pulses noted, equal bilaterally. Now we can have you stand up. We're going to look at your muscular system now. First, I'm just going to inspect. I'm going to look at your upper and lower extremities, and the contour is equal and they are symmetrical. I'm going to inspect your muscles. I'm going to look around the tendons, the ligaments, the cartilage of your muscles, and just look at the skin. They are equal. I don't notice any lesions or swelling. Next, I'm going to look at your muscular and look if they're equal bilaterally, and your muscles are equal bilaterally throughout. Now we can test your gait. I'm going to have you just walk back and forth for me, and I'm looking for any off balance. Your coordination is intact. Now we're going to test your tandem walk. Just walk toe to heel for me. And your coordination and balance is intact. Now you can test your plantar flexion and walk on your toes for me. And your balance is intact. And dorsal flexion, walk on your heels for me. And your balance is intact. Now I'm going to test Romberg's test. I'm just going to have you close your eyes, and I'm going to have you stand here for 30 seconds. I'm just going to make sure there's no swaying or off balance. And your coordination is intact. There is no swaying or off balance noted there. All right, now we can move on to your range of motion. So we're going to start with your head. I'm going to have you do flexion, extension back, then come central, and do flexion to the left and flexion to the right, and then rotation and rotation. Your range of motion of your head is intact. Now we can do your shoulders. So you're going to do flexion, extension all the way back, come central. You're going to do abduction, adduction across, and across. Touch your scapulas for me, and come up to 90 degrees, and do interior rotation and external rotation. Okay, now we'll look at your spine, and if you turn around, I'm going to have you do flexion forward, extension back, okay, and then do lateral bending for me. And while you're down there, I'm going to palpate and look for scoliosis. No scoliosis noted. I'm going to have you do rotational to each side. Okay, spinal range of motion is intact. Now I'm going to have you lay on the ground for me, and we're going to look at your hips. Okay, So on one leg, I'm just going to have you extend up, extension, flex down, downward, no, your hips, there we go. We're going to abduction away and adduction. All right, and we're going to do internal rotation and external rotation. Okay, good. Full range of motion of your hips. Now move on to your knees. Have you bend your knee for me? Do extension out and flexion back. Good. Full range of motion of your knee. Now I'm going to do your MCL and LCL. I'm going to make sure those are intact with the vagal force. So I'm just going to hold at your ankle. Okay, it is intact. And I'm going to test for ACL and PCL with the drawer test. And it is intact. Those are intact. All right, and you lift your leg up. And now we're going to do dorsal flexion. So you're going to flex your ankle, correct? And that is intact. And plantar flexion, go down. And your ankle range of motion is full as well. Now we can have you stand up and we're going to do your strengths. Okay, we're going to start with your biceps and triceps, so bring your arms at 90 degrees. I'm going to pull against me, and push against me. Your biceps and triceps are 5s over 5s. We're going to do your shoulders, raise them up for me. Okay, your shoulders and deltoids are 5s. We're going to do your glutes, just squeeze back for me. Okay, and now you can take a seat. And your glutes are 5s. All right, we're going to do your hamstrings. So I'm going to have you pull, 5s, pull, all right, and then push out. Your quads are also 5s, over 5s. Now we'll do your toes. So bring your toes out for me. And we're going to do plantar, you're going to flex your toes down and dorsal up. And your toes are 5s over 5s as well. Okay, now we can do your deep tendon reflexes. I'm going to start with your triceps. +2. I'm going to go to your brachioradialis. +2 to your brachial. +2. And just hover your knees for me. Your patellar. +2. Do your ankle jerk. Just relax, relax. Relax. +2. And then we're going to test Basinski's sign. And looking for flexion of your toes.